Hello everyone and welcome to online repertory series by Dr. Ghanshyam Kalathia 2021. So this is the second year of online repertory series which Dr. Kalathia organizes, and I'm really glad to be part of this. I want to thank him for giving this opportunity for to me to share my insights about repertory. So myself, Dr. Yamini Ramesh, and I practice in Indore, India, and I'll be sharing with you how I use repertory in my practice. So let's begin. So I just love this quote, which says that medicine is a science of uncertainty and an art of probability. So similarly, repertory is also an art. But repertory is an art which makes your probability very certain, okay? Because it has a lot of clinically verified symptoms or rubrics, and when you use repertory along with materia medica, it makes your prescription doubly sure, 200% sure. And it also reduces or removes your biases about the symptoms, because your memory is limited. You cannot learn and cannot remember each and every symptom from materia medica. So repertory is very essential, and after learning and using repertory for many years, I understood that it is so vital for your practice, for a good practice, for an unprejudiced practice. If you practice only with the help of materia medica, no problem, but it will make you little bit, prejudiced, because you cannot learn so many symptoms. So see what happens with materia medica. This is a beautiful materia medica which has all the symptoms, all the parts, all the features. It's just like a car which has all the features you want. So it's complete. Okay, this is a brand new car. And see what happens when we go to repertory. So what we are doing in repertory is we are breaking down the symptoms in different chapters. So when we create a rubric, we break down materia medica and put that in specific chapters. So just like when your tire gets punctured, you don't buy the whole car. You just go to the tire shop and buy a tire. Similarly, what we do is we break down materia medica symptoms and we are putting it in different chapters. So let's see what happens to car when we go to repertory. So our car was materia medica. So see what happens to the car. So this is our repertory. Okay, so we have just fragmented it into various parts, various chapters. This is a difference between a materia medica and repertory. Okay, so the question now is which repertory to use and when to use the repertory. So I will tell you, you have to use the repertory. According to me, I use repertory in every case. Even if I am sure of the remedy, still I would use the repertory just to confirm my remedy, my simillimum. And that makes me even more sharper and more exact in prescription. So now the question is which repertory to use. So I would say that it depends on case. Just like homeopathy, like we say that every individual is different, he needs different remedies. I would say every case needs a different approach. You can't have one approach and you solve all cases. That doesn't happen. You need many approaches. So you need many repertories also. If case has more generals and your totality is very strong, I would suggest you go for a bigger repertory like Kent's repertory or complete repertory or synthesis repertory. So if you have a complete case, your totality is very strong, you have to use a vast repertory. Okay, and that would be like complete or Kent. For me, it would be complete, because complete is just like a extended version of Kent's repertory. If you have more therapeutic symptoms and not whole case, if you want to go with only clinicals, not many generals, then go for a Borix repertory. It is a therapeutic repertory basically. If you want to find out peculiar symptoms, and when you are generalizing symptoms, or you find generalized symptom, when you are applying the Bonning-Hossen's approach of grand generalization or Boger's approach, then you can use Patak repertory or BBCR. Okay, so the use of repertory depends upon the type of the case, basically, and you have to choose very wisely. And it also depends upon your skill to use the repertory. If you don't know anything about repertory, don't go and use that repertory. First master the skill, the art of using that repertory, and use, and then apply that. Second thing I want to tell you is, you have to master at least 2 to 3 repertories. Study them well and use with skills. That will really help in your practice. It will make your practice way better. Okay, so let's talk about Complete Repertory by Roger Van Zandvoort. And this repertory I really like. This is one of the vast repertories we have, which has this anatomical division of chapters. So Complete Repertory is an extended version of Kant's repertory, because Zandvoort felt that there was some additions needed when he started working on it. But later he integrated a lot of other repertories also and rubrics into this repertory, and it's one of the most extensive, the biggest repertory available with us, with approximately 45 chapters. So if you see the plan and construction of Complete Repertory, it is just like Kant's repertory. It follows the rule from general to particular, and also it is divided anatomically from head to toe. So you will see anatomical divisions are given in the form of chapters, and it follows the pattern of this general to particular symptom. So first of all, you will see a general symptom, and then the particular or peculiars into the subrubrics. Okay, so these are the chapters in the Complete Repertory. So this is the 2013 edition which I use. Though there is this Complete 2020 is also available now, but I use this older one which I have. So let's talk about gradation. It has 4 grades. So first grade, the boldest symptom you will get in bold uppercase letter, as it is shown in the PowerPoint. The second grade you will get in uppercase, which is not bold. Third grade symptom will be in italics and bold, and fourth grade is a normal, Roman character. Okay. So rubric arrangement is also very simple. You will get the general rubric, then you will get the sides of that rubric. Suppose if you are looking for a pain symptom, so then you will get pain, and then sides, whether left or right, then at what time it gets aggravated or ameliorated, then you will get modalities, and then associated symptoms or concomitant symptoms, and then the peculiar symptoms, like whether it is extending to some part, where it is localized, and what kind of sensation comes in the last. So the first thing you will see in the repertory is general rubrics, then sites, then time, then modalities, and then localization and sensation. Okay, so I'll tell you when to use Complete Repertory. So in my practice, I have seen when you get a good case, okay, where many symptoms are present, okay, and we have a good totality, you go for this repertory. When general symptoms are available, physical generals, mental generals, when you want to search some new rubric and you're looking for some new terminology, then you should use this repertory. Because if you go for a little older repertories like Boric or Kent, you don't get the new terminologies, some clinical terminologies. Okay, so you have to use this repertory. And also, if you have some group of remedies in your head, say if you are thinking about snake remedies, or if you are thinking about some mineral remedies, and um, and you feel that these remedies are little newer one, not well proved, or not the old remedies, then also you should use Complete Repertories. Because in other older repertories you don't get those newly proved remedies, because they are new and they are just added into into these repertories. So complete is a great repertory to look for newly proved remedies. It has very many additions. So this is my first choice of repertory, always in any type of case, but mostly where the totality is very good, because it is very extensive. So it has very less number of limitations. Okay, I don't see any shortcomings in complete repertory. It is an extensive repertory with lot of additions, and in this repertory you can also get old as well as newly introduced remedies. So that's a kind of upper hand of complete repertory. So let's talk about case examples. I will show you two cases which I have used complete repertory. I hope this will make the subject easier for you, this topic easier for you. So let's talk about case one. This is a case of a female 30 years old. It is not a very old case. This is a recent case for me, just 6-8 months back. I saw this case. But I took this because repertorization really helped me to choose the remedy in this case. And this was a very severe pathology, rheumatoid arthritis with anti-CCP antibodies were more than 500 and RA factor was also very, very strong. This female was in real pain. Okay, and she is only 30 years old. So she told me that after delivery, she just delivered a baby 9 months ago. All the joints were very painful. Backache was severe, and she went to a rheumatologist, and they prescribed her HCQ, okay, and omnocortil also for 2 months. And after that, she was little okay, but not really well. Her ESR was very, very high, can't lift anything. She was not able to lift anything. The backache was aggravated during menses, sometimes 7-8 days before, and which is also aggravated in bending forward. Lower back had immense pain, and from last 6 years this pain was there, but actually they got to know about this rheumatoid arthritis just few months back. And after recent delivery, which delivery happened in the just before the lockdown, the pain was aggravated. The pain was aggravated in lying down, bending forward, standing from sitting on ground. So whenever she used to sit on the ground, and after that if she's standing, the pain is too much, and the pain is only ameliorated by sitting steadily. Okay, so if she's sitting for like long time, then she's fine. If she's standing from sitting, that makes her worse. Right hand has a lot of pain and swelling. She had 3 deliveries so far. First baby died after delivery or in delivery. We don't know about this. They said it was a stillbirth. In second delivery, she had delivered a child in 2014, and third was in 2020 March. So during first delivery, backache started, and they did a cesarean section, and they said that the baby was stillbirth. Okay, so baby died in the delivery itself. She said that since this incident happened, I became sick, doctor. I didn't feel anything. They told me after 4 days I was in a bad condition, and for 4 days they said they didn't tell me anything. They just told me after 4 days of death of my baby, and I felt that how it can happen. How it was. My pregnancy was okay. Everything was okay. Still, why this happened. So she was scolding a doctor, and she felt that it was a very strange incident for her. In 2014, the second delivery happened, and she delivered a baby girl who was okay. Backache was tremendous in second delivery also, and in the second delivery they did an emergency cesarean section because of some complications which she couldn't understand. And when I asked her that, do you have any recent stress or tension or in your past? And then she told me a very good thing, which became a deciding factor for me to give her the remedy. She told me that just a month after her marriage, the husband went to the jail for 3 months because husband did some fraud of he faked someone else's signature and drawn some money from the bank of his boss, and he went to a jail. And this lady was newly married, and she was in a very bad situation. She said, I lost my hope to live the life, and it's been so many years to my marriage, still this thing bothers me. This all keeps bothering me. Whole day I think about my children, my husband, because this court case is still going on. Okay, so I'm really worried about them. I feel alone, and I really don't like that feeling of loneliness. She feels tremendous loneliness inside. When I asked more, she said that when my husband was in jail that time, he was in the jail for only 3 months. But that time also, I had the same feeling. I felt immense loneliness. I didn't have any support from the family. I faced it all alone. So when the husband was in jail immediately after her marriage, she used to stay with the parents, and the in-laws were not really supportive. And she said that I'm always scared for the family. Like when my first child died, it was very shocking for us. I used to cry for nights together. I didn't sleep. I couldn't sleep for many months. It was very lonely feeling, doctor. I felt like, in Hindi she said that koi nahi hai ab mera, there's no one for me. By nature, when I asked her about her nature, she said, I'm a very simple person. I'm happy if my family is good, if my family is healthy, I'm okay. I don't want anything else. More than that, I don't want anything. My family should stay healthy. If my child gets sick, or some notice comes from the court for my husband, then I'm like gone, and I'll be very worried. My husband's case is still going on, so that's another stress going on in my life. Then I asked about more about herself, and she said, I have one more problem, that I don't have sound sleep. So then at this note, I asked her, do you get any dreams? So she said, yeah, I see dead people, dead relatives. And the strange thing is that in my dream, I fight with them. I fight with these relatives. And I never did that actually. But I saw me and my aunt fighting in a dream, and she laughed for this dream. And she said, I see ghosts also in my dream. So dreams of ghost inspectors are there. I care a lot about kids and husband, but I feel they don't understand my love and care for them. So at times I feel irritated with them. They are everything for me, but they argue with me, and then I also react in anger. But this doesn't happen often. So this was about her. So see, this was the case, and we want a remedy which has the pathology of joint pains or muscular pains. We need a remedy where person needs the support of family, and the family is the most important thing for a person. Okay, because for this female, the family, husband, kids, that's her world, that's all. And she has this immense lonely feeling. She had this in starting also, and now also when the husband is there, everything is okay, she still feels alone. She is very anxious about the family. Dreams of dead relatives is very strong. Dreams of fighting with people, fighting with people who are dead, or who are there. Chronic backache and sleeplessness are the main things which we need in the remedy. So just after taking the case, I was thinking of the remedies, and I did some repertorization. So see, I used complete repertory, of course, and I took these rubrics: back pain, all the peculiar symptoms of the back pain. So back pain, bending, aggravation forward; back pain, sitting, amelioration, because the only thing which was giving her amelioration was sitting; back lying, aggravation; anxiety; extremities, pain in the joints; and pain in rheumatic. Okay, so can you see the remedies which are coming up? Sepia, calica, bruta, sulfur, colchicum, rustox, and colocynth. And again, I did a broad repertorization of her mental symptoms, because the mental symptoms were really pronounced. very peculiar. So I took mind dreams, dead bodies off, dreams of dead people. And this is a very, very important rubric. I learned this rubric only through this case. I didn't know about this earlier. So dreams, quarrels, strife, dead relatives with. So when she said that, I had a fight with my aunt, whom I never fought when she was alive. I was looking for a rubric and I got this, and it has only two remedies. That was really striking for me. Then sleeplessness, anxiety about the family, anxiety about future, pain, rheumatic joints, fear of alone being, dreams and of ghost inspectors. And can you see the only remedy which is covering most of the, not only, not most, in fact, all of the symptoms except one, anxiety about family, that is Calica. Okay, so Calica is the medicine which came very pronounced in the repertory graph, and I gave her LM4 because she was on heavy steroid dose and also on this immunosuppressant drugs, and I wanted to give quick relief, so I used LM potency. I gave LM4 for 1 month regularly, and you can read from Shankaran's book. He says the main symptom of Calica, we all know that the Calica belongs to fourth row of the periodic table, and it is Cali remedies are all about family and taking care of the family and doing the daily routine, and they are really anxious and worried and dependent remedies. So the main symptom of Calica is fear of being alone and desire for company. In Calica women, there is this tremendous anxiety and fear when she is alone. She seeks to belong to a group or family so that she's never alone. So what happened with this woman was she got married to a family, to husband, and husband went to jail just after a month of the marriage, and she felt all alone. Then when she delivered a child, the child died suddenly and she felt extreme anxiety. Okay, and since then all the problems started. So see, for example, frightened and trifles, fear of being alone, started easily from noise, from touch, dreams of ghosts, all the symptoms are there. So I was very sure of the remedy. See, Dr. Shankaran says she becomes anxious. This is a situational materia medica of Calica. In Soul of Remedies, he writes, she becomes anxious if her child falls sick or doesn't do well in exams, and she can become irritable and impatient with him. Similarly, when she feels that the husband is not supporting her enough, she becomes irritable, quarrelsome, and nagging. And we have this dreams of dead relatives. In Calicut shows her extreme concern for her family. One of the big aggravating factor for Calicut would be sickness of the member of her family, especially the supporting one. She feels forsaken when she doesn't get the support she needs, and this can make her very irritable, angry, quarrelsome, and shrieking. Okay, and also dreams of quarreling with dead relatives of dead persons as if they were alive and quarreled with her. This was a learning for me, and this came only from repertory. Otherwise I would have not known and remembered this symptom. And it is a very, very well known remedy for backache after delivery or abortion, spine very painful while eating, and burning in the right side of spine. And it is an amazing rheumatic and joint pain remedy. Okay. So this is a remedy for backache, for rheumatism. It affects the soft tissues and musculature. It has this weakness, dependence upon the family, and also loneliness. So overall, it covered everything. And just after 15 days, she had immense amount of relief. She was much better. Her joint pains were better, and she went to a rheumatologist, and he decreased the dose of omnacartil. Though the HCQ doses were same, but they reduced the dose of steroid, which was really a good follow up for me. 1 month later, when I met her, almost after like 1.5 months of first prescription, she was much better. Joint pains were almost 40% better. She said that I never felt this much of relief. So even 40% was so much for her, because She had very bad joint pains. I really hope, she says that I really hope I will get fully better by your treatments. Pains are much less, little dysmenorrhea she had, and nothing else at all. In this case, I used complete repertory because the case obviously had very good totality. It was a detailed case, and in such cases, if we use a vast, bigger repertory, then it gives you a very good search, and you can confirm your remedy from every corner, from every aspect of the case. Okay, so this was first case. Let's go to case 2. This is a case of a lady, again 54 years old. She had two major problems. One was lacrimation, which was constant, watery eyes full time. Water is coming from eyes since last 10-12 years. So from last 12 years, she has tried a lot of lot of medications, but nothing helped her. She went to many ophthalmologists, and they say you have dry eyes, you have allergy and all these things. So alternatingly, she had dry eyes and lacrimation, both the things. 6 months back, I checked with eye, watering increases in fan, AC and air, sometimes itching in the eyes. Maybe I have dogs. She said, she had two pet dogs. So she said, maybe because of the dogs, I have this itching due to pet allergy, because all the time they are with me. She had mouth ulcers almost since a year, acidity from 8-10 years. So she had this chronicity of complaints. She has acidity, sour water comes to throat. In throat, I feel cough is there, and doctors told me it is because of the reflux. So she said that I know I don't have cough. It is just because of the gastroesophageal reflux that I get this cough. I did an endoscopy, and they say acidity is there. Burning in esophagus mainly after lunch, aggravated by dal, by pulses, heavy food and fried food. Dry cough in the throat which doesn't come out, no expectoration as such, mouth ulcers are there. So she said 1 year back we went to Rajasthan, and after that this mouth ulcer started. And she went to a dentist, and they gave some gels to apply on the ulcers, but it didn't help. And she has strong desire to eat chaat and salty things, and also a little bit of spicy. Thirst is less. She's hot patient, and on head she perspires a lot. When I asked about stress or tension and her lifescape, she told me that she shifted to India 2 years back, and she said since then I really feel sad and lonely. 30 years she lived in Dubai, and now they are, now she's not able to connect with people in India, though she is Indian. But she said, here I don't feel connected with people. People in Dubai were very open minded, and we used to party, we had a good group, good community. Now here everything is changed, doctor. So I really feel lonely inside, though I have few friends here also, but I just feel that I'm not able to connect with them emotionally. Husband's business is here, so I had to come here. I have like two children, a daughter and son, and both are married happily, living separately. At the age of 39 years she got her menopause suddenly, and she didn't know why it happened. Uh, she said, I was not mentally prepared to shift to India. Here, the lifestyle is different. And in Dubai, it was very posh lifestyle. I really liked it. I used to feel like home over there. I had huge support from my friends over there. It was more like a family for me, but now there is no one. She said everything was good over there. Sab bahut acha tha, and now see, we are shifted here. I miss my friends, the rapport which I had with my friends. I miss that. And here, and I asked her, what do you miss? And what do you feel when you say that here you don't feel good? Then she said, she gave me a very, very nice thing. She said, here all are rigid. I felt, in Dubai, the people were more understanding and flexible. Here they are not. वहाँ सब बिंदास थे. इधर नहीं है. People are hesitant here, not open. This is the biggest difference which she perceives. And also one major thing, doctor, I feel here is no one supports us. I find myself very lonely. There I had my group, my community, so it's difficult for me to shift here. But husband said so, I didn't say anything. I had to do it. And when I asked her about her nature, she said, I am happy go lucky. I'm a very happy person. I do a lot of musty and jokes, and sometimes I feel sad and lonely, and I also cry, but that's not a very frequent thing. Very often I don't do that. I love music and reading good literature. So she is a music lover and also a literature lover. And then she told me one major thing which she had was leakage of urine. So she said, during laughing or coughing, my urine gets leaked. 20 years after second delivery. So her second child is 25 years old, and after this delivery, almost 20-25 years ago, this problem started, and this is continued. So she said there is no elasticity. I use panty liners on daily basis regularly, because I know that urine gets leaked. And she had past history of polycystectomy 5 years back, jaundice when she was 19, tonsillitis, kidney stone she had like 3-4 times, and each time they did lithotripsy. And she said that, doctor, if you can do something about my leaky bladder, then it will be nice for you, but I know that there is no cure. I have to, you if you can reduce it, I'll be grateful. So see, what is the totality? We have uh, the chief complaint for which she came to me was lacrimation. Okay, and then she said, I have changed my location, so she has this not feeling good feeling. Okay, then acidity, which is aggravated, especially after meal, after lunch. Talkative person. She is a simple one. When I met her, I just felt she is a simple one. She doesn't hide. She told me everything in one go. She has this urine leakage, which is a chronic problem. She loves to go with friends. She loves her community, loves the company, and also desires it. She's not a lonely one. She feels lonely but desires company. See, have you seen, can you see this imbalance of fluid? Because her menopause was checked suddenly. Then she had this dryness, and on another hand, we have this watering from the eyes. So both the states are present. So either fluid is too much or checked, or dry. So imbalance of fluid is there. Okay. This, understanding pathology and understanding the symptom also leads you to the group of remedies that helps you to decide, because you have to match the pathology with the sphere of action of the remedy. And then she has renal stone 3-4 times. I felt she was very yielding. She just accepted what the husband said, doesn't oppose, though she didn't like it. She's more a acceptive kind of person, and very friendly, likes to eat spicy and salty. That is our totality. So let's go to repertory part. So I took all these rubrics: loquacity, coughing, aggravation, heartburn after eating. She was communicative, bladder calculi, and I took these involuntary urination symptoms because this was really peculiar. Each time from 25 years, she is having this involuntary urination while laughing, sneezing, and lacrimation, constant dryness in eyes, spices desire for, salt desire for, and lacrimation in wind. So she's, whenever she is driving against the wind, she will have this constant watering from eyes. And this is my repertory chart. So see, one remedy which is covering everything through and through is natrum mur. And natrum mur is one remedy which is known for fluid imbalance. Okay, it has a lot of dryness symptoms and also a lot of secretive symptoms where there are profuse secretions. So I gave natrum mur 200. This is a remedy belonging to row 3 in mineral kingdom, and it has good action upon eyes and digestive system, and also creates imbalance. And we know that natrum are mild, yielding, emotional people, and they desire salt and spicy. And when I read Fata, see what Fata cries: lacrimation with redness, burning, acrid from affected side. Eyes feel drawn together. itch and burn, must wipe them, vision blurred and wavering, lot of eye symptoms. And we know the very known, involuntary urination while walking, coughing, laughing, has to wait a long while for urine to pass if others are present. They are very shy if there are other people around them. They can't pass urine. As with other remedies of mineral kingdom, Natrum mure patients are very organized. They are independent and dependable. They care a lot about structures like the house, relationship, date and timings. This lady was really concerned about her husband, her Dubai house, her close group, and she was dependent on them, seeking for support, and also she is very dependable. So I have observed that many of them like music. So, just casually she said, I'm a music lover and I love reading. And when I read this in Dr. Shankaran's book, I was very sure of the remedy. They're also fond of novels and other literature based on relationships. Okay. There is certain reservedness about them which makes them want to express themselves through art. So they express themselves through music, through painting, through other arts. And this is from Boric. Increased involuntary urine when walking, coughing, and has to wait a long time for it to pass if others are there. So I give Natramur 202 doses and some placebo, and see. The first follow-up I got after 1.5 months, and she said that her acidity is reduced, mouth ulcers are better, which was not better by any gel, any local application, no medicine, and eyes watering was same. Actually, the chief complaint was same. Urine leakage reduced a lot. She was much better overall. Her sleep appetite was good, but the itching and watering of the eyes were actually same when I got this follow-up. So I gave another dose of Natramur to her, and she came to me after 3 months, and urine leakage was reduced by 80%, which was there for 25 years. And this was really amazing for her. In fact, she said, in fact, I didn't feel it in last 1 month at all. So in last 3 months, she had only 2 episodes of leakage of urine. Acidity got better completely, no acidity. Mouth ulcers are not there at all. Watering from the eyes this time was reduced a lot, but still not completely gone. So this is still there. Now I have started enjoying here with my new friends. Her perspective about India has changed through Natramur. She said, I started enjoying. I thought I should tell you this because I really like to be here. I have made new group, and she's now able to enjoy with her new community. And she also says that, I felt that people are really not flexible here, but that's not true completely. I feel they are also okay. So these two cases were from complete repertory. So I want to tell you a few lessons which I have learned from practicing for so many years and after doing repertorization. So repertory helps to reduce your limitations. Okay, it helps us to reduce your biased thinking. It confirms the remedy. So I'll tell you what happened to the second case of lacrimation. When I took the case, I really felt that she was a very communicative and very a talkative person, and I was constantly thinking about phosphorus. So though phosphorus is a very close remedy to Natramur, but when I did the repertorization and I checked all the symptoms, Natramur came up really very strong, and it removed my bias of giving phosphorus. So this happens in many cases. So it confirms the remedy we are thinking if you are using a repertory, and if you are not thinking about the remedy, it actually breaks up your bias. And we, our prescription becomes much surer, and much stronger and exact. So bigger repertories like complete is compilation of other repertories. So it has good amount of info and additions of new rubrics and new remedies, which makes it really helpful. Other lessons which I have learned are there are many presentations in the case. So when you take like number of cases or say 10 cases, you will understand that not all cases are same. In some cases you get good totality, in some cases you get peculiar symptom, in some cases you get only pathological symptoms, in some cases you get good generals. So all the different type of presentations need different types of techniques of repertorization. So use individualized technique based on the individual characteristic presentation of the case. That is very important. Rubric understanding is also very crucial, and for that you need to get acquainted with the repertory and the style of the author who's writing a repertory. So you have to get acquainted and you read that repertory and you know make that repertory your friend. You have to understand the rubric by reading it continuously on regular basis. Then so many people ask this question, how to find exact rubric? This is the biggest problem of homeopath's life. How to find exact rubric or exact symptom? So first thing is understand the symptom fully. You have to understand and digest. Dr. Shankaran always used to teach us that don't take anything directly into repertory. So if person is saying something, understand, digest, and then you convert it into a keyword. So first understand the symptom fully, convert it into a keyword or synonym which can be found in the repertory, then choose the repertory. Okay, so first three steps are understand, convert, choose the repertory. Then after choosing a repertory, locate the keyword into a chapter. Then if not, if you're not using manual repertory, go into a computer repertory and search it. And then watch the rubrics, see the rubrics and study the sub rubrics. The sub rubrics will give you the exact the exact symptom with minute details. So use that exact one or the closest one after studying all the sub rubrics. That's the way you find out the exact rubric. Okay, so I have few tips for you. First step is use repertory in each case to confirm your remedy, but do not finalize the remedy only based on repertory. Okay, go to Materia Medica, check, and then give the remedy. Use it as a tool and master it. Repertories are very essential for practice and you can skip them completely. So learn the use of 2 or 3 major ones. Okay, repertories are very, very essential for practice. Select the repertory based on case and also based on your experience, which repertory you can use in a better way. Understand the meaning of the symptom fully and then convert it into a rubric. Don't take every symptom or every sentence which patient says. Not every sentence is a rubric. Okay, understand and then make it into a rubric. Don't interpret the rubric on superficial level. That's my message. Otherwise it will be a disaster for you. Final code for decision is Materia Medica, so always refer that. Always refer the Materia Medica to differentiate, to finally select your similar one. To learn the meaning of the rubric, go to the source location and see what was the conversion procedure for the rubric. So in rubric it sometimes it feels like it has some other meaning, and when you go to a original symptom you feel like, oh my god, this is something really different. So if you want to learn it in a deeper way, go to the source location and see what meaning the author had. Get aware about newer additions in the repertory and verify them, and then use them. If you find the author reliable, then only. If you are very sure of the remedy and if you see any peculiar symptoms repeatedly confirmed in particular remedy through patients, then highlight that rubric and make note of it. This way you will be able to make your own repertory. So this is a very important and little advanced a type of practice. You can also do that because it is a way of making your own Materia Medica and repertory. So if you are very sure of the remedy, say you have 10 cases of pulsatilla, and if you see 1 or 2 symptoms which is repeatedly confirmed in each case of pulsatilla, Okay, so you just note down that rubric or that symptom, highlight that and make note of it, so that you know whenever you see that rubric in some other cases, you can confirm whether it really belongs to pulsatilla or not. Okay, choose the symptom if it is deep, it is central, it is unconditional, it is universal and not circumstantial, and it is really a symptom of the patient and not the disease. Then that is the symptom for you, and that symptom has the quality to become a rubric for repertory. Okay, so that's all from my side. I hope you enjoyed the presentation. If you have any questions related to my cases or related to repertory, you can write to me on my email rjyamini@gmail.com. I really want to thank you for watching this video, and I want to thank Dr. Ghansham Kalathia sir from the bottom of my heart for giving me this wonderful opportunity to share my insights with you. Thank you so much, sir.